Hello, everyone. I just want to thank you for joining us for our second Long Beach Black Health Equity virtual town hall. There's a lot of places that you could have been tonight, but you have chosen to join us on this evening. And I really want to say thank you, and we appreciate your time here on today. So before we begin, we will be talking about Black health and Black health equity. However, I think that it's important that while we're having discussions around Black health equity, that we really have a conversation or just introduce health equity into the conversation on this evening. With that being said, the Black Health Equity team really wanted to express a statement of solidarity. And I'm just going to read a statement, particularly on behalf of the Black Health Equity team and the Asian American Pacific Islander community. So in 2020, we have seen a significant increase in the number of hate crimes against our brothers and sisters of the Asian American and Pacific Islander community. Unfortunately, many of these attacks have been against the older, more vulnerable members of the AAPI community. The Black Health Equity team stands in solidarity with the AAPI community. We stand stronger together against all forms of violence, racism, discrimination, xenophobia, and white supremacy. We do not uphold the myth that the AAPI community has not been negatively impacted by these forms of hatred. Health and health equity encompasses the rights for every single human being to live a life free of fear, violence, and intimidation. So again, thank you. We stand firmly with the AAPI community and against all forms of hatred, against all racialized minority groups in this country and beyond. So thank you for being with us tonight, and thank you for allowing us to take a moment of solidarity as we move forward to talk about Black health equity. So our agenda is simply that we're going to first discuss our wonderful COVID care package awardees. These awardees have put in a labor of love, and they'll get to talk about each of their care packages that they have developed. They're culturally tailored COVID care packages for Black residents in order to reduce the impact and mitigate COVID-19 among Black residents in Long Beach. Then we're going to explore health equity with specific emphasis on Black health equity. And then our purpose overall is to explore ways in which the community can collaborate with our awardees of the COVID care packages and how we can work together as a community to achieve Black health equity. So the first part of our presentation, or our town hall, will focus on culturally tailored COVID care packages. This section will be moderated by Chelsea Okundola. She is a Black Health Equity intern in the Department of Health Science.
Good evening, everyone. I hope you're all having a wonderful day so far. Thank you all for being here. We really appreciate seeing all of you join us today. Without further ado, I'm going to go ahead and begin introducing each of the organizations that developed and distributed culturally tailored COVID-19 care packages to Long Beach Black residents at risk for COVID-19 infection. So the first organization that we're going to be highlighting is Colorband Shoes. And the spokesperson that is here with us today is April Parker, who is the owner.
Hello, everyone. It's wonderful to be here. My name is April Parker, and I'm the owner of Colorband Shoes. Colorband Shoes makes a a product called April Parker Flats. And we designed these flats because as a woman of color, we have a lot of disparities in foot care and foot health. And when I hit 40, I realized that my feet should be a priority. And I couldn't find shoes that were affordable and comfortable and had all the health benefits, arch support, the right amount of cushioning. And so I developed it. And we've been selling our shoes here in Long Beach. And with that, we've met amazing people, and we've been able to work with the community and support our community in so many ways, not just giving them shoes, but supporting a lot of community drives, community events, food drives, and just whatever services that we can offer to support our community.
Thank you, April, so much for sharing that with us. I have one more question for you before we move on. What did you put into your COVID-19 care packages and why?
So when we found out about the grant, I was very interested because as a minority, I started looking at what I needed in my home and what I thought other people would need as well. And the most functional thing that I had in my home was my thermometer. And I don't know if you guys have these thermometers, but it prevents you from having to stick a thermometer in your mouth and give it to another person, because we're checking temperatures. And even with people wanting to come to our home, I didn't want to stick a thermometer in their mouth. So I thought that would be a great addition into our care package. We also gave them enough of the PPE equipment to service their entire family. Sometimes we get a mask or two, or we have our own personal mask, but we wanted to ensure that the families had enough masks for their entire family. The sanitizing wipes. We also included a lot of literature on resources in the community, the Uptown Guide, and just a list of, and the Healthy Living Guide that was provided by Elite Skills to ensure that the community had access to information about what was actually going on in the community and what these resources were. And I also, I chose a linen bag because I just feel like linen was very connected to our community, and it was a beautiful fabric. So yeah, that was in our bag. We had masks, hand sanitizer, a large bottle of hand sanitizer, along with the thermometers and the sanitizing wipes.
All right, thank you so much for sharing that. I think the thermometer is quite an interesting addition. I think that's very helpful. But I look forward to speaking more with you later in the panel discussion. So we're going to be moving on to Project Optimism. And here to speak with us about that is Ishmael Pruett, who is the co-founder and CEO. So Ishmael, do you mind telling us about Project Optimism?
Yes, absolutely. So my name is Ishmael. I'm the co-founder and co-CEO of Project Optimism. We established an organization to really foster hope and positivity, optimism in our communities. I actually established the organization as an undergraduate student at Sacramento State back in 2015. And I was just really disappointed in how the community was being served. So I decided that I had the skills and the resources to bring people together and to serve our community, essentially. So our approach is pretty simple. It's for the community, by the community. What we do is we identify community needs, we establish a platform, and we find community members who could serve people. And through that process, everyone's spirit is being fed and everyone is feeling this sense of optimism and hope. For me, God and Jesus gives me my optimism, but for other people, faith looks different. So we utilize that word optimism to really to describe what faith looks like and positivity into our future. So you as the beneficiary, you feel good about yourself, you got your new mask, whatever it is, that service that you just received, but the person providing that service also has a spirit that's also been fed. And that's how we do a lot of things within Project Optimism, from community engagement to personal and professional development for K through college students.
Thank you so much for sharing that with us. Found that extremely insightful. So next, I would like to ask, what did you put into your COVID-19 care packages and why?
Got you. So we did two different care packages. One, a lot of our work with Project Optimism, we have an initiative called the Everyone Eats Tour. Essentially, we're supporting people experiencing homelessness with organic meals provided by Eat Naked LA. It's a meal preparation company, so we provide them with organic fruit and vegetables, but also an actual hot meal made to order, or not made to order, but made that day to be provided to the people experiencing homelessness. We also provide them with masks and hand sanitizer to over about 150 Long Beach community members. Then in partnership with April Parker Foundation, the Swazi Shop, Elite Skills, and Agape Children's Foundation, we provided a drawstring black backpack with Project Optimism branding on there. So, you know, it had the swag on there. But we also threw in children's masks, a significant amount of those masks, about 20, in addition to hand sanitizer. But we also added in blue light glasses. Blue light glasses because a lot of our students are, you know, they don't have sports, a lot of the extracurricular activities that they would engage in. So as a result, now we have more screen time. So we decided that would be beneficial to them to take advantage of. Then also shout out to Elite Skills for providing us with the Uptown guides that we also provided in our packages. So that's what we got them.
Thank you for sharing that. I think that the food is an amazing addition, as well as the blue light glasses. I know I would love to have some blue light glasses.
I got you. I'll let me.
Thank you. And I look forward to speaking more with you during the panel discussion. So the next organization that we're going to be talking with is the Swazi Shop. And Ashley Dawkins is going to be speaking about it. She is the owner, and she is also a CSULB alumni.
Hello, everyone. My name's Ashley. I'm the owner of the Swazi Shop. That is a picture of me right there. I'm one of the grant awardees for the care packages, where I created 750 care packages for the city of Long Beach. The way that we decided, I and just the entire team of awesome people I've been working with decided to make the package culturally relevant was really kind of focused, being mindful of COVID with the stylish appeal of having custom face masks, adding a piece for mindfulness where actually every bag received a different crystal, depending on the person's mood. Is oh my goodness, it's kind of custom picked for you. But we had selenite crystal it's all about attracting good energy, like angel-like energy. We had black tourmaline, that's for protection, and rose quartz, that's for love. In addition to that, we also provide a sample of the moisturizing oil that comes from the Swazi Shop, because I'm you know what? In this process of COVID, we're always using hand sanitizer. We're always washing our hands, and our hands can end up dry. So I was you know what? What's more culturally relevant than not being ashy in the community? So we definitely put that into the bag. And then lastly, I had just a basic guide for mindfulness from the Swazi Care Kit, which was all about mask up and reminding people the basic W's of COVID, which is wash your hands, wear your mask, and watch your distance. Make sure you hashtag cleanup. And it's more or less take this opportunity to practice mindfulness in the household. Maybe it's time to clean your room, reorganize that random drawer in your house. Maybe it's time to actually take the time and clean up that little middle section of your car. And really just honoring the pause that everyone has to take in the middle of this pandemic. And lastly, it is glow up. So it's just taking this time to really read, write, implement healthy lifestyle changes, whether it's just taking a walk around the block once a day. And then really just promoting people to connect to nature. So with this, I've been collaborating with the amazing organizations of Project Optimism, April Parker Shoes, Agape, Elite Skills, and so many more. And I can say that this opportunity has been a great way to really get the community connected to the people and really start something life-changing. So yes, that's it.
Thank you so much for sharing that. I also wanted to give you an opportunity if you would like to tell us about the Swazi Shop and what you do outside of care packages.
Well, thank you. I appreciate that. So what the Swazi Shop is, beyond just creating these care packages, the Swazi Shop is an Afrocentric, all-natural, holistic company where we sell skincare, feminine products, and also bulk herbs. I'm really all about getting Black people back to nature and connecting us to our most holy self, meaning having a our mind, body, spirits, and emotional senses all in check, in alignment, and however you want to perceive like love, God, universe, like I'm not tripping on that language, but it's like, let's at least take the moment to acknowledge it needs to be checked. And with the Swatch Shop, this has actually been my baby for the last like 2 years. I started while I was a student at Cal State Long Beach, soliciting in between classes. I was also heavily involved with the Black Student Union, just the Black student community on campus. And I just always recognized the ultimate need in all the conversations and all the meetings was just a lack of self-love, self-knowledge, and self-respect. So we can actually love, know, and respect others. And with that mindset, it morphed into a company where people are like, oh, like really trying to help people become their best self. She was selling products to me. I was selling products to Ishmael. Definitely one of the first customers. But yeah, Swatch Shop is literally all about like self-elevation so we can have communal elevation and then global elevation.
Okay, thank you so much for sharing that. I know there's a lot of people in the chat. They're going to be very interested in asking more questions in our panel discussion later. But moving on, we're going to be briefly talking about the Salt Lounge, sorry. And we have Wesley Holder here, who is the owner of the Salt Lounge, here to talk about that. So can you tell us about the Salt Lounge, sorry.
Good evening. Yes, my name is Wesley Holder. I'm one of the owners of Salt Lounge along with my wife, Tanai Holder. She's in the photo. We're so excited to be a part of this meeting today. This project for us was a lot of fun. The Salt Lounge is a wellness space located in downtown Long Beach. And our mission at the Salt Lounge is to help guests grow mentally, physically, and energetically. We're known for our Himalayan Salt Room, which is an amazing space that you can go into. It reduces stress, really helps boost the endorphins, promotes mental clarity. And then we have a host of other services that enable individuals to feel a lot more at ease and a lot more stress-free throughout the day. One of the things that we enjoy most about what we do is we really love connecting with our community. And so this opportunity was an even more cool way for us to connect with our community. One of the things that we enjoyed the most was seeing people's reactions every time we passed them one of our care kits after they purchased or every time they dropped into the Salt Lounge. And so it not only allowed us to connect with the community, but it allowed us to organically promote awareness and let people know, listen, Long Beach is here to help. And so I found so much joy in this. We were kind of like blown away at how fast people received the kits and how engaging people were when they told friends, go to the Salt Lounge and grab one of the kits. And it was just an awesome experience for us.
Thank you so much for sharing that. So I would like to ask, what did you put into your care packages and why did you choose to put those things?
So what we did with our care package was we really wanted to give we wanted to make sure people had the essentials. And so what we did was we put high quality face masks into our care packages. We also went and put a lavender infused hand sanitizer. And then we put resource cards in our care packages just to let our community know, look, there's information available to you so you can continue to build your awareness. And then lastly, we included gloves. We wanted everyone to have a pair of gloves because it's one thing to have hand sanitizers, but it's, having your mask is great, having your hand sanitizer is great, but if you can just have that extra set of gloves, because you never know what you might run into. And so it gave our guests that much more of a peace of mind. And so we wanted to give our community those essentials. And the target for us was we wanted to make sure that we engage the elderly community as much as possible since they're at such risk. And so we made sure we had a certain amount of kits just for the elderly community. And then we also made sure we had a certain amount of kits just for the homeless community. And so before we knew it, we passed out 500 kits. And it was just amazing to see how appreciative everybody was. The elderly community, the homeless community, our Salt Lounge community, everyone was so appreciative of it. And so all I could say was this whole project warmed my heart and my wife's heart.
That sounds wonderful. It's amazing what you did. And, I would like to thank you, all of the organizations here for, giving back to the community. So without further ado, we're going to move on to our last organization that I'm going to be introducing, and that is Earth Lodge Center for Transformation. And we have Ms. Yardenia Aaron, who is a board chair here, to speak about it. Can you tell us about your organization briefly, please?
I sure can. Hey, everybody. Good evening. Maybe you're eating dinner. Maybe you're attending this webinar, but I'm hoping that you're getting fed on every level, because being here with everyone, I'm getting close to 100 attendees, is really feeding my spirit and hearing about all the care packages that are happening. Our organization is located in West Long Beach. Now, especially after the summer where we saw the reconciliation studies, we know that in West Long Beach, there's a lifespan reduction of 7 years between where we're located in East Long Beach. So the health outcomes, to be on a panel talking about health, talking about the effect of things that can really shorten our lives, is truly an honor. And so what we are is we're an all-inclusive space, LGBT, queer, straight, anyone who identifies with the rise of the feminine energy on the planet finds their home here at the Earth Lodge. And we're based on not really resurrecting, because our opinion is that it never went anywhere, but really pushing to the forefront African-American Southern Indigenous practices. There's a lot of medicine, a lot of knowledge that we got from grandmom, from great-grandmom, from pawpaw. And a lot of that was gotten during, some might say, during the enslavement periods, going back to Africa. It's in our DNA. There's a lot of medicine that happened when there were no hospitals. And so it's exciting to be on panel with other groups who believe in the healing power of the medicine that we bring. And we don't have to go any further. Who we are is enough, being the descendants of chattel slaves. We don't have to go back to Africa. We don't have to do anything else. We are enough. And that's the tradition of African-American Black indigeneity that we uphold. And it's a village approach. With our bags, you'll see that we have bags for kids. We'll have bags for adults. Like we say, a lot of the communities that we serve are on the fringe. We have a residency program where sometimes people who are houseless come and stay for 10 days, a bit of respite, just to be on the land, because it's a beautiful botanical space. So, you know, after June, when everything opens up, we're looking forward to having everyone over for a little bit of ritual, a little bit of ceremony, to find a home away from home here in West Long Beach. So on the picture you see Cheyenne and you see Amaya. Cheyenne developed Project Bloom. She graduated from our Girls' Rites of Passage program, structurally passing down the knowledge that we got and that we have amongst our community to our youth. And she created Project Bloom because with everyone being online, a lot of the youth were experiencing increased rates of low self-esteem and suicide. So she created a program at the Earth Lodge to address that. And that's what I mean by it's a village approach. To give a little bit of sense of how we targeted the distribution of our care packages, we went the outreach route. We weren't as comfortable having folks come in due to shelter in place, but our anchor leaders know how to go out and find the folks, right? We have an anchor leader who is heavily involved in BLM Long Beach. Over half of those who come to the Earth Lodge are frontline activists, come to connect to our roots, to rejuvenate, to go out and fight the ills of the world all over again. So BLM Long Beach is in the house as anchor leadership at the Earth Lodge, as well as we have one of our anchor leaders works for the county during homeless outreach as her day job. So off the clock, she knows who needs these care packages the most. And that helps with our targeting, because by going out into the community, you can decide who you give a bag to, right? Cheyenne and Amaya staffed a youth fair here in Long Beach at DeForest Park. So they were able to take some of the care packages to outreach to the youth and give some away to those who were most in need in that way as well. And also through CAT 911, the mutual aid rapid response work that developed also out of last summer. And a lot of organizations may be a part of that here, where organizations are out there helping themselves and responding to crisis, eliminating or reducing the need for the police. Also are out on the streets delivering care packages through CAT 911 and through another transitional housing network. And so that was our approach to getting these directly into the hands of Black Long Beach. And it's a mix. Now, we had like 11, it was like an 11-point plan. And it was different for the homeless population or the houseless population or transition population, we went with the vinyl bag, something that was durable, something that could easily be washed, something that was water resistant. And then did you see a snack? You know, Pat felt strongly that don't walk up without a little something to eat in a transitional or in a homeless bag. That was a must, right? It has a flashlight in there, in addition to having the sanitizer, the mask, you know, some of the traditional PPE. We have an aromatherapy because it's mind, body, and spirit. We knew firsthand that COVID had a big effect not only on the body, but on the mind. So it's got a journal in there. It's got our aroma therapy aura balancing picture. Thank you for mentioning the lavenders. That's in there as well. We also had an approach of recycling Black dollars. Our hand shea butters were handmade by our anchor leader as well. And those were put into the kits. So 3 times over, for 3 out of the 10 points, we were able to recycle Black dollars as well. And through working with April, we're able to actually collaborate on the design of our bags. So it was a great village community experience being a part of it, and not to mention the organization and staying in touch and actually being a part and invited to panels like this by Amber and Crystal. And so last thing to say is that the kids bag, we knew that we had to, our commitment to literacy. Like I said, we have children's ceremony as well, keeping children in the earth, safe places to run around barefoot, and a safe and loving adult space. So they got some comic books, you know, honoring the loss of Chadwick. You have your Black Panthers, Black superheroes, Black super heroes. We celebrate that. So in the commitment to fun, literacy, youth targeted, we have that. And there was a couple of Funkles. We like some of those Black Funkles as well in the children's bags. So village approach, intergenerational, targeted outreach in the community, serving those who are most hardest hit and those who are most in need and those who are on the front line in the activist community. Thank you for letting us share.
Of course, I appreciate you, targeting your bags to the groups that you were giving it to. I think that was really insightful thing to do. So now we're going to begin our panel discussion or Q&A session. So I have a few questions here that I will be asking, and anyone can feel free to, any of the panelists can feel free to unmute themselves and answer as they see fit. And if you're in the audience and you have a question, feel free to start putting those in the chat box. So our first question for the panel is, what prompted you to pursue the COVID-19 Care Package Award?
I could start off. I think at the end of the day, things like PPE is a basic need, it's essential. I don't think people should have to pay for things that are essential to their personal well-being and livelihood. I've done a lot of work with people experiencing homelessness and historically underserved communities, and the masks they have that are, you could tell that they've been wearing them for weeks and months. That's the only mask that they have. It was embarrassing for me because I know I have significant amount at home or in my car, and those people should have the abundance as well. So I saw this opportunity, an opportunity to serve our people, which I've never actually ever seen a grant that was targeted to a specific ethnicity of people. It's usually a income status or a region or something like that. But our people, I was like, oh, I gotta hop on this. So, it was a blessing to see the opportunity that the city of Long Beach and Amber Johnson and everyone else on that committee, Crystal, said, oh, this is a need for our community. I was like, Project Optimism believes in what they're trying to create. We're going to take advantage of this and show what we could do to serve our community members.
I like to echo what Ishmael said. I think what enticed me was that the city was actually doing it. And if the city was going to get behind us supporting us, then we should all raise our hands and say, I will help. And so that inspired me that the city actually allocated separate dollars for this initiative.
And just to even echo that, like, I would just love to say how the city specifically stated that is for the Black/African American community. Like, I find it very important whenever there's funds allocated for the community just to promote equity because I hear a lot of conversations about equality, but some communities need a bit more than others. And I feel like it's very important to emphasize and highlight the power behind just honestly this opportunity, and knowing that it is for us. And I'm so grateful that the resources that were given to the community are by us and the community leaders. So that's why I want to echo.
I'm never going to pass up on an opportunity to give Black people a gift, to give them something that shows that we care. We don't often get a lot of gifts, let's just be real. So the idea that we can get a gift, even after last summer, the trauma of last summer, after going through COVID, after the rise of mental illness from all of those, what a beautiful opportunity.
Mm-hmm. And one note I would also like to emphasize, like I've been loving just to see like the different views of Blackness coming together for this. Like I feel like we have we just have all the different just subcategories of Blackness. We have the modern day millennial, we have the like grounded elders coming in with the earth energy. We have the Project Optimism who's been in the street, not just for Long Beach, but for San Francisco, like Sacramento. We have the Salt Lounge. We have all these different organizations that are serving different communities and have been in the community for different spans of time and have different things to provide. And I feel like to see that the amount of diversity within the community being represented and then also being served is such an honor to witness, nevertheless be a part of. So I just want to say thank you to all those grant awardees.
Okay, thank you guys for sharing. It was amazing to hear all of you guys talk about your inspiration and your reasons for pursuing this. So if no one else has anything else to add, we are going to move on to the next question, which is how did each of you ensure that your care packages were culturally relevant towards Black residents?
I have no problem going first for that one. Oh, would you like to go? Oh, sorry. So for me, as a Black woman, and I'm peers with a lot of other Black people, it was just literally collaborating with like a lot of my peers and connecting with local organizations such as like leaders within the Black Student Union of Cal State Long Beach, individuals from the New Era group, which is honestly a pack of young Black foot soldiers who literally go around like the city of Long Beach doing and putting in the work. In case you guys are not familiar, please tap in with me. And just kind of figuring out what they want with, of course, just like the intuition that was led by me with what I believe in with the Swatty Shop philosophy. So that's what inspired what I put inside the care kits.
Does anyone else want to share what or how they ensured that their packages were culturally relevant?
I think I mentioned it briefly in my introduction, but it was really about having a conversation and just thinking about what do our kids need, what do our people need the most, the things that are essential that they may not prioritize, right? You have one master, you may not think I need to go get 3 or 4 more to have just in case I drop it or something. We pride ourselves as an organization. Our board of directors are all young professional and all identify as Black, and 80% of our staff are African American as well. So we just had a conversation. We was like, yo, we got this grant. What are we doing with it? How are we going to serve our people? And we just started putting ideas, and then we started thinking about pricing and everything. Then April Parker hit us up and was like, look, I can get you the discount if we order this much. And I was like, everything just started coming together. So I think being a part of the community, being surrounded by people who are in the community, it was just more of a conversation and saying, we have the funds, so let's remove all excuses and get people what they need.
Yeah, and for me, I thought, equity, what should all families have? It's relevant that we have access to the same quality of products and the same quantity of products that other ethnicities have as well. And so I was focused on making sure that the families had what other people had to make sure that it was equitable.
Okay, so moving on to our next question. What challenges did you guys face during the process of developing and distributing these care packages? And how did you overcome these challenges?
I'm going to go on a lighter side and say when we ordered all this stuff, it was a lot of boxes. So we had to, I mean, being together in this group, I mean, it was an amazing collaboration. So whatever we needed, we reached out to each other for. And so we had a lot of packages. We had all these boxes. We had to come together and assemble them. And so we reached out to Sharon Elite Skills, and she was able to allow us to store things there and get together and assemble them. And so it was a big challenge. I honestly, personally, when we sent out the announcement that we were doing the drive for the care packages, that first day was scary. We only had about 4% of the people registered, and I was getting kind of concerned, but sure enough, we were able to get everyone registered for the event, and before we even started, there were already cars lined up around the street. So I was very happy to see that we actually turned out and showed up.
Just to answer, I feel like there was definitely a lot of logistical paperwork situations that was new to me, as like this is like what is my first grant opportunity. But I feel like the Black Health Equity Center and all the staff and faculty who work had done everything in their power to make the process as easy and as possible, like just easy as possible. I feel like it's always very known, like whenever like there tends to be issues whenever Black people try to get resources from institutions, but I feel like with just the positionality of like multiple leaders from Dr. Amber Johnson, Crystal, and all these different individuals in these positions, they made sure that they were the difference to make this idea come to fruition, and supporting us in a lot of different ways, from coming to our Zoom meetings, and even leaders such as like Ava Parker, who like coordinated to ensure that all the grant award winners had a safe space to communicate and got all the resources that we need. So to be honest, like the grant process by itself without support would have been difficult. I think we wouldn't even be able to comfortably have this Zoom session because it's like, oh my goodness, it's a little embarrassing. But I feel like the monarchs, the leaders in the space really came together and made sure that everyone can perform at a point of excellence, that we can even hold our chins high and said that we did this.
Hey, I want to give a shout out to Chelsea, because she keep emailing me, but it's always some good stuff. She's reminding me like, oh, don't forget about this. So to echo what Ashley said, I want to put spotlight on Chelsea. You email me like twice a week, 3 times a week, but I love it. Keep doing your thing.
I want to give a shout out to Ishmael and your team of volunteers. I mean, they were on it. I got a whole nother perspective on millennials and Gen Zs. They were there working hard, taking charge with excellence from packing to distribution. They seemed like they were a professionally trained team, and they were motivated and happy to serve the community. That was a very proud moment for me to see.
All right, thank you all for sharing. I think it's really nice to hear how much community you guys have created within yourself amongst the awardees. That's really beautiful to see. So the next question that I'll be going into is, how can people get in contact to get a package if they are in need or if someone wants to collaborate?
So for me, for the Swire Shop, we still have some care packages left, and you can literally just visit your friendly Shades of Africa on 4th Street, and you don't even have to purchase anything. Just be like, hey, Sister Renee, can I have a Swazi care kit? And she'll give you one with her smile and conversation about why you need to invest in gold and silver. And for individuals who are ever open to collaborating, I'm all about the community and I'm always down with it. So just hit me up or like contact me professionally or casually, and I'll put my contact information in the chat.
Yes, I would say the same. Contact me. I'll put our Instagram and my personal email, our organization email in the chat. We do have a significant amount left We are in the process of working with Shelly to get some, I know she's doing distribution April 27th, I believe. So we'll be working with her 24th to get those out. And then we're also looking into a potential another date in May. So just reach out to me directly. We also are going to be donating a significant amount of them to Barton Elementary School and to the Carmelitos housing community. So hit me up ASAP if you need it.
I would say if anyone wants more care packages, I know for the care packages I created, they are gone. But if you go onto Instagram, and if someone from BHEC could put in the Instagram page, if you follow BHEC, we're going to be doing more of these care packages. We're going to be doing more in the community. So please follow the BHEC Instagram page to find out more about what this group of individuals and the City of Long Beach is doing in the community. I'm sure we're going to be developing more care packages because there's still a demand for them.
And at the Salt Lounge, we love to collaborate, so we are open for collaborations. You can reach us through social media at the Salt Lounge LB. Our email address is contact@thesaltlounge.com. I'll make sure I put it in the chat. Unfortunately, we're out of care packages, but we are looking forward to doing more projects. So hopefully we can have some kids care packages available soon. We're really excited about that project. I have a baby girl, so like dad mode's kicking in. I'm just thinking of all the cool ways to get creative with this, but we're open to collaborate. So if anyone is interested in collaborating with the Salt Lounge, don't hesitate.
Okay, thank you guys for sharing how people can get in contact with you. I hope somebody who is in the audience and may need that can take this information and hopefully reach out. So another question that we have is, what has been the most rewarding part of developing and distributing these care packages?
I think for me, the most rewarding is one, seeing our community members come together, young professionals, Gen Z, millennials, serving their community and starting that work early. But also seeing people take off the mask that they have and putting that fresh one on. It's like putting some new J's on or whatever, your tennis shoes, put a new pair of socks on. It's a good feeling. I know what it feels like to put brand new socks on. I'm sure y'all know what I'm talking about. So seeing people take their mask off and put that brand new mask on, or utilizing the hand sanitizer right away, that confirmed that they were waiting to use it. No one was just throwing it in the back seat and say, like, I'm put it with the rest. So it confirmed that there's a need still, even while we've provided what we provided to them.
I found that I felt a feeling of deep gratitude, knowing that our anchor leaders, and actually a few who actually came here to the Earth Lodge were given some too, but the idea of the outreach piece, of meeting people where they're at during a pandemic, gave me a lot of fulfillment. With so much virtual, so many virtual experiences happening with the Earth Lodge, not having ourselves open to the community in the way that we were open before that, having something in hand to be able to give besides encouraging words during a pandemic, something tangible, produced a feeling of deep gratitude.
Just to even echo off of that, I could just say that the grandest feeling I had was just like being grateful that I could be a vessel of a blessing. I always say, like, my biggest ultimate goal is just to be a vessel of blessings, just to like as many people as possible, and seeing to provide like this opportunity, providing these resources, especially during this trying time, has been so rewarding. And then also trying to just normalize the narrative of self-care and addressing a lot of the secondary issues that's coming with this pandemic, from mental health, emotion, like all the ologies that need to be acknowledged. And honestly, that's going to impact and leave a print for all the generations that are to come.
Okay, so at this time, I want to ask the audience again, if you have any questions, please feel free to put them in the chat so that I can ask our panelists. But I do have one last question of my own before we move on to any audience questions that we might have. So how do you make sure people in need are receiving the care packages, and what are your strategies?
So my strategy, we worked with the Long Beach Unified School District Coalition of Involved African American Parents because they had access to every Black student slash Black family in Long Beach. And, you know, the school district already identifies those who, for instance, get free lunch and need assistance. And so we sent out an email blast through the school district, and we got an overwhelming response of families registering to receive the care packages. So that was our strategy. We also use social media as well as we issued a press release, which actually got the news to come and do a story on our giveaway.
For us at the Salt Lounge, fortunately, our location, we're located right off of 9th and Atlantic. So the area allowed us to find it really easy to distribute the care kits just amongst our community within a few blocks. There's two very popular churches on each side of the intersection. So we partnered with the pastors of each church, as well as the customers that just came in and out of our store. And so luckily, based off our location, we were positioned in a way we were able to distribute very easily to the community.
Okay, so if no one else has any answers for or anything else to add for that question, I do see one question in the chat from Lucy Huckabee. She asked, what types of health-related educational pamphlets were placed in the care packages? If they needed a medical referrals, was there any information about medical resources that are also, I don't know if she finished typing the question, but about medical resources?
Well, one of the things which I don't have with me was the Healthy Living Guide, which gave a plethora of information about how to live healthy and be well in Long Beach. There was also the Uptown Guide, which also was a lot of resources from mental health to immigration, youth support, housing, medical. It's all in the Uptown Guide. There was also the African American Heritage Diet. I'm sorry if you guys can't see that, but there were a lot of resources because the grantees really collaborated. They had resources from other events that they had done, resources that they were recently contracted to do, and we looked at it as an opportunity to give everything we could back to the community.
I'm not sure how to get rid of my virtual background because I know sometimes you can't see it, but here's the guy that April was just talking about. I don't know if you guys can see it or not. April, I just happen to have the one that you gave me today.
Yeah, Robbie got the last April Parker kit.
All right, well, I don't see any more questions in the chat, so I want to go ahead and, oh wait, I think, okay, one question did just pop up. Okay, so Tabechi Uday asks, is there anything that was not included in the care packages that you believe would be beneficial if you were to do this another time? That's a great question.
So this is my opinion. I think we had a lot of great kits, and you know, and I've tried to collect some myself. But I think that for the community, because we were all doing these kits around the same time, it was a bit confusing as to what they were getting from who. And so I think that it would have been maybe beneficial if we had a little bit of everybody in a bag. Like I'm hearing some of the things that were in the Salt Lounge's bag. I'm like, oh, I would have wanted that in my kit too. But I think that if we could have collaborated and maybe gave a wider amount of people a little bit of everything that we had.
I think for me too, one of the things that we're going to actually put in that we didn't was actual journals. We wanted to give everyone a journal to practice mindfulness and practice journaling. How we see that as a form of meditation, just to kind of get out of our heads, because I know a lot of our realities that we've been stuck into our house. Some people, it's a small apartment with cousins and auntie and cousin boom boom in them. So having a journal for you can just let it all out on a piece of paper. I know it's beneficial to myself, and I've heard other people saying that it's beneficial to them. So I think next go around, we'll probably consider adding journals for folks to take advantage of if they choose to.
If I could piggyback on Ishmael's statement, and I did put it in the chat, one thing that might be useful might be some type of a notepad and something to write on. They could write down questions or emergency information. I don't know. That's just the first thing that came to my mind.
Yeah, my grandma stayed with an envelope that she wrote everything on, so I'm sure she would have benefited from that notepad.
Okay, and this is going to be our last question so that we can stay on track with the rest of our town hall. So they said, thank you for your incredible work in the Long Beach community. From your experience in working on these very important high impact projects, what did you learn and what did you think should come next to support Black health equity?
For me, definitely we need more community outreach, more gifts for the community to show our love and support for them. But also we need, I think we need a safe space for the community, a trust between our collaborative and the community. I think we're building that. But I think our community would also benefit from literacy, understanding that how they're living, how we're living is not equitable, and understanding what those divergences are, so that they can speak up and speak out, so they can be empowered to want better and want things to change. Sometimes our reality looks so normal, we don't see that it is not. And I think health education literacy is critical for the community.
To piggyback on that statement, away from this evening literacy, I find it very important for literally compliance advocates. I feel like there's a lot of individuals in our communities who qualify for resources that a lot of government funded institutions give out. However, honestly, we don't know how to access them. And I feel like there may be a lot of social workers and things like that, but there's a lot of power in being able to just have a space where people can sit down and fill out maybe an EDD form or a food stamps form and all these other resources. So what I've learned from this is there's a lot of people in the community who are in need, and there's a lot of resources in the community for those who are in need. And we just gotta help people. We have to, for one, not just outreach to these individuals, but also let them know that they are owed resources so they can be successful in this life.
All right, so I'm sorry, go ahead.
Chelsea, I was gonna share the importance of safe space, the ability to move about the city, the county, the world. And I'm talking about a safe space for everyone. I'm talking about leveling up, challenging ourselves, challenging our community, and making space for everyone. No one should be thinking or feeling, especially within their own racial group, that they're going to experience, whether it's racism, because that exists even within our ethnic group. We need to stop hypersexualizing our cis males. quote unquote beautiful woman needs to know that she can relax, that she is in safe space, that she's not going to be experiencing a type of sexual predatory experience. A Black queer person needs to know that they are safe. A single mother needs to know that in community, her child is not going to be subject to a predatory experience if she's not watching them 24/7. The youth need to know that they don't have to be perfect, and if they don't get it right, they're still held. We need safe space, and the elder needs to know that if something doesn't look right, somebody will ask or say that something's not looking right. What can I do? And so it's a safe space, not just from the murders that happened last summer, but a safe space on every level: straight people, queer people, old people, young people. And we see that in the village. And then there's the accountability piece for those who are not creating safe spaces. There's a community accountability. We need that so that we'll never go back. You know, in my opinion, last summer was the line. We'll never go back there. Whatever we need to do, we'll never go back. And it should be safe for all.
All right. Thank you for sharing. I appreciated hearing what everyone had to say. I want to give a huge, huge thank you to all of our panelists for taking the time to come out and speak about what they've been doing. And of course, a huge thank you to all of you guys for, coming out and listening, and also for your amazing questions. So with that being said, I want to hand it over so that we can move on to the next session in our town hall. We're going to be talking about Black health equity.
Thank you so much. I wish you can see all of the wonderful messages that I'm getting, because what you're doing is really pouring in, and really it's really impactful in a way that this is what we can really achieve when we pull our resources, our partnerships, and when there is investment in the Black community. We know that equity isn't always fair, and we have to acknowledge the need, and the necessity, not for safe space, as well as culturally tailored health education, outreach, literacy, as you see with the COVID care package awardees. So I just want to thank you for your work. They didn't tell you about all of the tireless effort in the background. They showed you the finished product, but there it was, a lot of blood, sweat, and tears put into those, and love put into those care packages. So I just want to emphasize my appreciation for your work, and just being able to pour into the community. And as part of the Black Health Equity team, these are some of the things that we really envision when we started thinking about how we want to use the funds of the Black Health, or how do we want to allocate funds to the Black Health Equity Fund, excuse me. But this is something that I'm just really proud of, and I'm so thankful for you all for stepping up to the plate. So thank you. We are now going to transition to our panel discussion on Black health equity. And we have some wonderful panelists here for you today. This session is going to be moderated by Noemi Mendez of the College of Health and Human Services. She is a Department of Health Science, and she's also a Black Health Equity intern. She's finishing up her first year in our MPH, or Masters in Public Health program. So thank you, Noemi. We'll transition to you.
All right, thank you so much, Dr. Johnson. Very excited to be here with you and with all of the panelists. This was a great segue to this next panel, so thank you so much. So with that, we'll begin with some introductions of our panelists. So first, we will start with Ms. Phaedra Allen. So Phaedra holds a Bachelor of Arts degree in Psychology and African American Studies from California State University, Fullerton. Also a Master of Social Work degree from the University of Southern California, and a certificate in diversity and inclusion from Cornell University. She is currently employed with Cal State Long Beach, where she serves in administration as a program coordinator and a lecturer with the School of Social Work. A member of the Executive Board of Directors for the African American Cultural Center of Long Beach and chair of the Programs Committee. Phaedra has been an active community partner in the Black Health Equity Collaborative. So welcome, Ms. Allen, and thank you for joining us.
Thank you for having me. I'm excited.
Awesome. So next we will have Ms. Alicia Culture. So Mrs. Alicia Culture earned a master's degree of social work centered in critical race theory from California State University, Dominguez Hills, and a master's degree of public health from the University of California, Los Angeles. She has over 15 years of experience in advocating for Black, Brown, and Indigenous people in the healthcare space. She is the CEO and co-owner of Advantage Healthcare Now, and is committed to advocacy for vulnerable groups within the healthcare space by providing health education. Most recently, Advantage Health Now, LLC, was awarded a grant from the City of Long Beach to provide health education centered around the Black community and COVID-19. So welcome, Mrs. Culture, and thank you for joining us. All right. So next we have with us Ms. Veronica Clanton Higgins. So Veronica Clanton Higgins earned her master's in social work from the University of Southern California and is currently pursuing her doctorate in social work. She is a therapist, author, adjunct professor, and TEDx Compton Boulevard founder. A native of Compton, California, she is known for her community advocacy, including addressing the disparities in mental health care for Black and Brown communities. And through her consulting from BCH Prosperity Consulting, she ensures that people are provided the tools necessary to navigate the complexities of life and break intergenerational cycles of damaging behavior. So welcome, Ms. Clanton Higgins, and thank you for joining us.
My pleasure. Thank you for having me.
Thank you. Next, we have with us Dr. Kineka Hull. Dr. Hull is a reproductive, maternal, and child health researcher who focuses on reducing unintended pregnancies and improving birth outcomes among Black women. She is also the founder and CEO of Kinetics Research Solutions, LLC, which provides evaluation services, training on health equity and implicit bias, and certifies sexual and reproductive health educators on evidence-based curricula. Welcome, Dr. Hull, and thank you for joining us.
Thank you for having me.
Thank you. So next we have with us Empress Angelique Jackson. Empress Angelique Jackson is a certified transformational life coach, alchemist, speaker, holistic therapy, and quantum energy practitioner. She has led women to not only heal, but to empower them to live their life powerfully, abundantly, and authentic. Empress Angelique's professional career spans over 20 years within the holistic therapy, beauty industry, consulting, and higher education. She has worked with numerous organizations such as Battered Women and Children Shelters, American Cancer Association, American Foundation on Suicide Prevention, Black Mental Health, and is currently a member of Be Well Collaborative, a Black mental health organization dedicated to restoration, wellness, health, and healing. Welcome, Empress Jackson, and thank you for joining us.
Thank you for having me.
All right, and next, and certainly not the least, we have Miss April Parker. April Parker is a successful entrepreneur turned community organizer. She is known for creating such well-known brands as Eden Body Works and Color Band Shoes. In 2018, she founded the April Parker Foundation to empower, support, and strengthen children, families, and community through culturally engaging services that promote stability, security, and well-being. Welcome, Mrs. Parker, and thank you for joining us this evening.
Thank you for having me.
Awesome. All right. Well, I'm very excited to be here with you all again. And with that, we'll start our panel discussion. All right. And so I will ask questions, and each panelist is free to answer any question as we go through all the questions. And for the audience as well, you can please enter all your questions on the chat. All right. So the first question is, what does health equity mean to you?
For me, health equity means that no matter where I live, the color of my skin, what my income is, that I have equitable access to quality of life, to health, and that is supported by my community, by the government, and all the other governmental agencies.
I agree. I think that that support should ensure that everyone, regardless of creed, walk of life, color, is able to have a healthy and a happy and sustainable way of life. I think that a lot of times we use the catchphrases of equity and things of that nature and don't look at the long-term impact. I know for me as a researcher, you come up with this great project, you go in, you do a fantastic job, and then as soon as you leave, you don't leave that community in a sustainable position. So I think that we have to really look at health equity as being sustainable and making sure that that happiness and that well-being is long-lasting.
And I would
agree.
just add to that. Oh, sorry. I just wanted to add to that too, because just also clarifying what equity is. Equity is not equal. And I think sometimes we get the two confused, right? What equity is a distribution to meet the need, right? So when we're talking about equality, that means everybody gets the same number of resources, right? But when we're talking about equity, we're talking about communities getting what they specifically need. And if there's certain communities that have a different need, right? It's meeting that need so that everyone has a fair shot, right? To get over whatever that hurdle is. So just wanted to throw that in there.
Yes, most definitely. And to just add to that, I believe that part of health equity is having the ability to be able to have fair, diverse, and just opportunities that deal with mind, body, and spirit. So that diversity and that understanding and that inclusion and that opportunity to be able to access that which that community needs or that individual needs on all spectrums, from your mind, your body, and your spirit. So that means access to homeopathic and naturopathic medicine. It means being able to have access to insurance that is more diverse, that gives more opportunity for access to the needs that they need. So herbalism, and just including all of those things, because it's all very much vital within our community.
And just to add to that, we also want safe access. So when you think about Black women and maternal mortality and our babies that are dying at birth, we want safe access. So we want it to be equitable and we want it to be safe. So that's what health equity, it's far reaching. And, but then I feel that one of the number one things is we want safe access. And I like to give examples. So I was talking with a OBGYN, and she was working at a local hospital, and I won't say the hospital, but it's a magnet hospital. And she has patients that she takes Medicaid, which a lot of physicians do not take Medicaid. And the hospital did not want her to use certain equipment on her patients that were C-section patients. And this treatment or this machine reduces the risk of them having issues with their incision. And the hospital said because the Medicaid reimbursement was so low, they didn't want her using that machinery. And that was specifically for her Black and brown patients. Those are the majority of her patients that have Medicaid. And so we want equity and we want safety as well, even if we have access.
And I would like to piggyback off what my sister Queens have just stated. When we're looking at access and safe choices, as well as when it comes to mental health, we want to look at a framework that decolonizes mental health therapy to make it more culturally relevant and accessible to those who really need it. Because when we're looking at equity, we're looking at what is right for that population. And when we're looking at mental health, a lot of times it's built on a framework of white cisgender males. And so when we're looking at building access, we want safety and we want it to be relevant. So we have to decolonize mental health therapy in order for it to be reflective of the populations that we serve.
Thank you so much. So many great points, and even, especially decolonization of health. So very great points. Thank you so much. Let's move on to the next one. So how has your work contributed to health equity?
Well, for me, we deal with a lot of youth and families, and our work is really in advocacy. And actually, I mentioned earlier, there are so many resources and services to help bridge the gap for people of color that we just are unaware of, that we literally have to ask for, that no one's offering. And so a lot of our work that we think has been impactful has been in making sure that people get access to the resources that they are entitled to. And even when there's a no, we continue to advocate, we appeal, and we do what it takes to get to yes, to meet the needs of the community.
I would like to just go again. I'm all about collaboration and community and empowering. Ms. Phaedra Allen, I don't know if you remember me, but I ran the intern program over at a local nonprofit. And so that's when we pour back into clinicians or social workers that look like ourselves. And so that's how we also promote equity through education, through empowerment, through sharing of resources, and through collaboration, because we are collectivism. We are not ego-centered. We are about what serves the greater good of the collective so we can move it forward. And the work that I do with students, with clients in the community is always reflective of what is the greater goal and how can we move ourselves together forward as a collective, and that's through educating, empowering, and engaging with the community and collaboration as well.
Exactly. And to your point about education, informing individuals of their rights. So when people know their rights, they're empowered to speak without a shake in their voice. And even if they have a shake in their voice, they're still confident in what they're saying, and that what they're saying is going to benefit them and what they're saying is right. Versus doing the work for someone, you educate them on their rights so that when you're no longer there, then the individual can then move forward and work on their own, because Alicia is not going to always be there to advocate for them. But if they're there and if they know the information, we empower them with their rights as a citizen, because we have to remind Black and brown people, you are a citizen, you have those rights within America. And so once we educate them with that, they're able to then move forward with confidence.
So my work impacts health equity on a couple of different levels. So on the individual level, I work with young women from 6th grade to age 29, and I talk to them about their reproductive and sexual health. So we know that the reproductive freedoms that women of color have experienced have been traumatic from slavery until now. And so we have a lot of conversations about the ownership that you have over your body and the options that you have when it comes to contraceptive methods, when it comes to consent, when it comes to menstruation products. And so as a college professor, I see the majority of my students having some type of issue with affording menstrual products. We know that 1 in 6 African-American women between the ages of 20 and 24 may experience an unintended pregnancy. So that has all type of mental health implications, educational attainment implications. And so I'm working with them on how to have a mix between an Aisha Curry and a Cardi B. And so how to exert that in a way that it's not with the don't be fast and the typical other over sexualizations that we see. I work on it from a population level. I work with local school districts to supplement their sexual health education in the classroom and do it in a way that's culturally tailored. So we're talking a lot about what that particular district needs. So having them come up with something, because we have all of these formal sexual health educations, but if you're not talking about the lived experiences, I like what Deanna said earlier, that my grandmother's mother's mother told us about sex and told us about allowing the government to implant things into your body. When you're talking about how wonderful these things are, I'm not receptive. And so talking about a lot of the cultural and vicarious lived experiences that we talk about in our sister circles that may prevent us from picking a contraceptive method that might actually be best fit for us, that we're just not open to because of all of the negative things that we have heard. And so I look at it also from a systemic issue, because I actually go to the school boards and say, okay, so the students are having sex whether you or the parents want to acknowledge it or not. And so coming up with a way that is palatable for the individuals who are administrators. And then I also, as an educator, train other sexuality, reproductive health specialists of color. I know that just from speaking with students and myself, I'm more receptive to a provider who looks like me, who speaks the same language as I do, who knows how to get that vernacular down pat and say, look, okay, so this is what you need to do. And so just being able to do that, I'm able to hit it on different levels.
And as for me, some of how I'm able to, and the work that I do to impact health equity is through various different ways. So from a individual level, I help individuals be able to, I do what's called holistic grief and trauma release. So I help them to be able to release that trauma, release the grief, really be able to take that identity of a victim or of what society tries to input upon them and shift it away so that they can claim their power back, so that they can stand in their grace and be able to be more aligned with the empowerment of who they are and moving forward, that they can be able to heal through the trauma, they can heal through whatever happens. So we do that in a way, in a holistic way, from womb healing. We have safe, what I call goddess circles or sister circles, where it's a safe, inclusive environment where they can be open and be able to share and be able to express what they may be going through. So working with women who may be in domestic violence situations, working with women who may have been sexually assaulted or abused in some kind of way, working through childhood traumas, working through a lot of those things in a holistic way to release that away from them so that they can really be able to feel more whole. And so the work that I do is that wholeness. So holistic is whole, mind, body, spirit. So actually being able to shift their mindset, shift the way that they speak to themselves, shift the way that they see themselves, to be able to see themselves in the beauty and the light that they are, to be able to move forward in knowing that anything that they desire is possible, that they are beautiful inside and out, that they are magnificent, that they are worthy of so much more than what society may put upon them. Because, so that's part of the work that I do from an individual level. From a collective community level, I love to collaborate with other organizations, like being a member of the Be Well Collaborative, where we put on webinars and events that's geared around social justice and also around mental health, holistic health, and utilizing the different modalities in that. Working with Day of Healing, which is led by Shelley, who is prominent she's an artivist, and she's an amazing healer herself, and working with those and just collaborating within the community. So bringing resources to the community to let them know that there are many ways in which you can heal and be able to take off all of the things that you think you don't have, So being able to have access to understanding what you're eating, having access to growing food, how to grow your food, having access to being able to say, what am I consuming that's helping me or maybe hurting me in physically or mentally or whatnot, so that you can really become more healthy. Because when you're healthy as an individual, you're also healthy as a community, and that moves that moves us forward to being more empowered and more vibrant and more alive. So I think that's part of the things that I do on that level. On the other level would be from a corporate standpoint, where I go into corporations and I teach leaders within the company about holistic leadership. And what that is how to help your employees feel more balanced, less stressed, different techniques and modalities in which they can incorporate, like meditation and journaling and stress, reducing stress and walking away, having breaks that allows that individual, that employee, to be able to get back and center themselves, because a balanced employee is a more productive employee. A happy employee actually helps your organization vision and mission move forward. So those are just some of the ways in which I've been able to, that my work that I'm doing has been able to move it forward.
All right, thank you all. It sounds like all of you are doing a lot of work around health equity, so that's really great. It's great to hear that. So now, in the context of health equity, what does achieving Black health equity mean?
Okay, I'll break the silence. Okay.
Thank you.
So no worries. So the achieving Black health equity, and I always come from a mental health standpoint, because it's very critical that when a person walks into a room, and I think Ms. Kanika stated this, to speak the vernacular, they have someone that looks like them. And so in order to achieve mental health equity, we have to make sure that people who are thinking of becoming therapists have access to scholarships, they have access to grants, they have funding, because we never, number one, we know about the wealth gap, right? And so in order, it's very expensive to go to grad school to become a therapist, because a lot of people have to quit working, you're in internship, you're in class. So if we want to reduce the disparity in mental health and achieve equity, we got to have more clinicians who look like the populations that they are serving. And I think that is so critical. And Miss Alicia, Dr. Alicia, I hope I'm not forgetting your title, but when you said you like to give examples, I literally had a student that I was working with, and I'm a Black therapist at a predominantly white institution now. They called me in to help service the needs of our BIPOC students. So one student said that, I said, what's making you nervous? You've been experiencing symptoms. They said, white women make me nervous. Mind you, I'm the only Black clinician on the staff. So imagine this student who is suffering and experiencing this, not being able to share that with another clinician, because they are the ones that's making him nervous. And so that's what we achieve mental health equity, by having more clinicians, more mental health professionals. And I do not life coaches, certified healers, anyone who is reflective of the community, so we can get rid of the stigma, increase wellness, rewire those brains, get some somatic healing going on. And that way we can make a better path for upcoming generations. Because guess what? Trauma is embedded in our DNA. So if we start the healing now, the next generation has a wonderful chance. So increasing access for people who look like us to get trained to become mental health professionals.
So just to piggyback off of that, I think the last sentence you said, trauma is in our DNA. I think we go in with the best intentions when it comes to equity, but we have to realize that we are combating and navigating a long history of things and a long embedded system of things. And it's not going to happen overnight. And so the start is, like you said, practitioners that look like us. So I've noticed that someone said in the chat, a Black epidemiologist, we're rare, right? So like my heart, someone said the ancestors are rejoicing looking at the panel. what we do, we are rare, right? And so I remember not seeing a Black professor until college, and that was my African American studies professor, right? And being told, girls are not good in science and math, especially not a Black girl that's in science and math. And so, if I didn't have a mother who was an educator and who said, you're going to be good because if you're the only Black girl that's good, you'll always have a job, right? I had someone who pushed me towards that. So I think representation really matters. That's the one thing I hear from my students, walking into a classroom and seeing a woman of color. It's empowering. It makes them want to follow in the path. I think that we also have to really think about implicit biases. And I know a lot of times when we talk about implicit biases, we talk about biases from individuals of a different color, but we have to be real. We have some lived experiences and some biases. Like you said, if she's saying that a Caucasian practitioner makes her nervous, that's an implicit bias, which is going to make her unreceptive and not compliant to whatever that treatment path may be. So just addressing that and just being mindful that it's not going to happen overnight. But if everybody is doing their small part and taking a small win, that eventually we'll see some changes.
Yeah, and I just want to echo that too. And I love this. Let me just throw that in there. I do. And, just like Veronica, I side on, when I'm thinking of health, I'm thinking of mental health as well, right? And just overall well-being, as Sister Angelique had also spoke to. But, I think a personal mission that I took on some years ago was that, I'm committed to a mission, and where I'm at, whether it's employment or whether it's an organization, that's my current platform, right? And my mission has always been to focus on inclusion and making sure that when there are Black faces in the room, that those Black faces feel included and that they feel welcomed into those spaces. Because it's not just about the numbers or having you in the room. If you're in there and you don't feel a sense of inclusion, the emotional impact of that, right? The stress that comes along with that. And then also, thinking about, the stress is one of those intangible factors, right, that contributes to poor health outcomes for Black folks, and particularly Black women, right? So when we're thinking about that. But just kind of going back to, the fact that we need more Black therapists, right? So true. But also working with our non-Black therapists to know how to work with Black folks is extremely important. And working in the School of Social Work, I serve as a lecturer there, and working with the students, I'm very, very intentional to have these conversations with students and to normalize their discomfort and to normalize their questions, right? And we have to create spaces where people are comfortable to have dialogue. Our therapists who aren't Black or who are, or who are Black, right? It's such an important job, and it's such an important role that they have when they're working with our communities. So we need to be intentional to equip them with the skill set to be able to engage, right? So share some of the history, share some of the communal history, right, that they may not have. And so just keeping that in mind as well, right? So we just need to create spaces where these conversations can be had and to be intentional about that, right?
And coming from the physical health aspect, if we go back and just for public health, if we rewind back to when the pandemic first started, and the then Surgeon General Jerome stood on national TV and said that Black people are dying at a higher rate because we're more likely to have diabetes, high blood pressure, ... I mean, we can dial back as to why we're more likely to have those diagnoses. We were taken from our land and we were not fed our indigenous foods. So we can start there, okay? So if we're not gonna start there, but we're gonna talk about our poor health outcomes, that is not the reason why Black people were dying at alarming rates. Black people were dying at alarming rates because when they go to the hospital, they were sent home, or they were afraid to go to the hospital because no one there looked like them, or the physicians that may look like them may not look like them, if you know what I'm saying. So we have to really understand that with health equity, as it is related to public health, The data is sometimes skewed. There's so many different things when it comes to health equity in Black people, when it comes to health care. And if our healthcare component is not on point, we can't even get to the mental health component, because guess what? There's stigma attached to that. I'm not crazy. I'm not going to see a social worker. The social worker is going to take my kids. So then there's the narrative. I mean, I'm an MSW and I spend half my day saying I don't work for DCFS, and if I did, I'm not a baby snatcher, right? And so with that said, going back to what I put that foundation, and that to piggyback off of what Ms. Veronica was saying, we need match day in healthcare for physicians to include Black students, and that they're matched and they're not getting the leftovers that no one else wanted. We need them to gain access to these environments. We need for our HBCUs to have more funding for healthcare programs, specifically physician, nursing, such programs. There's statistics that show we have less physicians, Black physicians now than we did in Jim Crow. So what we need to do is make sure that there is inclusivity in all areas of healthcare, physical, going back to Ms. Angelique and the holistic approach, and that there is representation everywhere. And that's part of, if not the biggest problem, because anyone that knows me, they know that everybody is Black. My doctor is Black, my dentist is Black, my eye doctor is Black, the painter is Black, everybody is Black. Because not only do I believe in recycling Black dollars, I also trust Black people. And so we need to make sure that we have more representation so that equity is inclusive of financial as well as healthcare.
Well said. And, I think on that note that a lot of the training that medical doctors and mental health professionals get needs to include culturally competent information to ensure that they are aware of the challenges that African Americans face. But for health equity to happen, I think that educating our community on those disparities is important, as well as receiving the support from our community and our governmental organizations to actually do something about it, from mental health to education to employment, for housing, food, outdoor spaces, everything. All those contributing factors. And so once the money starts moving and the community starts getting engaged and the people start getting educated, that's when we can truly start to see some of the barriers, some of the gaps to close in this space.
I agree completely with everyone was saying, specifically like really being able to shift that narrative and be more inclusive, and being able to have more representation of us in all areas of health, in all ways possible, because I've been in rooms where I've been the only one. And I know with my daughter who was suffering through depression, one of her biggest things that she would always say, because we would go from therapist to therapist to therapist, is they don't understand. They don't get me. They don't look like me. They don't represent me. And so they don't understand where she was coming from. So it made it very difficult for her to believe in therapy, to even want to continue moving forward with therapy, because of those factors of them not understanding how to work with us and not having enough representation of us within those different fields in those different areas. So inclusion is important, education is important across the board, and being able to have the resources and having representation of us in every sphere. We do need more doctors that are like us. We do need more physicians. We need to be able to just really educate in our communities on the fact that there are multiple ways, and look at it as their health and healing toolbox. What's in this toolbox? You have your mental health therapists, you have your homeopathic doctors, you have your naturopaths, you have your herbalists, you have your different physicians, your social worker, where we all come together inclusively, collectively, working on a way to really shift the narrative within our communities so that we get the health care that we need, so that we get the healing that we need, so that we get the education that we need to start shifting things and narrowing the gap of health inequality, so that the equity from a financial standpoint, from a mental standpoint, from a physical standpoint, from a spiritual standpoint, from a collective standpoint, we begin to rise and be able to be a healthier community, so that we're no longer getting the little leftovers or the scraps or the lower, quote unquote, information or the care from doctors and physicians that where they just want to say, okay, let's just give you surgery, or I'll just give you this medication or something along those lines, things that are not really helping us to live longer, healthier lives.
Before we change this topic, I just wanted to say, as a faculty member at an HBCU, I'm finding that it's very urgent and important to stress the need for us to stay in our communities. I'm finding that not only do we have the shortages, as everyone noted, and how we need to ensure that representation matters, it's very tempting financially to sometimes not stay in our communities. And so I feel like you have to start early, emphasizing the need that we have for ourselves in our community, and how when you're doing something that you love and enjoy, the money will come. That a lot of times the reward comes from giving back. The reward comes from your impact. And I think that that is something that has to be stressed with the practitioners of color that we are producing.
My last comment is, I put a comment, where are the Black therapists? I have children that are constantly referred to DMH organizations. And when I request a Black therapist, there is none. The only place I've ever gotten a Black therapist from is Test of Cleveland. So there needs to be a collective to ensure that every one of these organizations that are contracted through the Department of Mental Health have a requirement based on their population to have a certain amount of minority staff on board, because pretty much everyone in Spot 8, I can hardly ever get a Black therapist.
Well,
So,
April, a lot of therapists don't want to work for DMH because of the oppressive nature of the way that it's set up. If you work from DMH, I'm sorry, but when we're looking at promoting mental health equity, it is not an institution that you will find a lot of Black therapists. So a lot of Black therapists will work for community-based organizations who may be contracted by DMH, or a lot of them start private practice. So this is where equity comes into play. A lot of Black therapists who have private practices only can take cash paying, because what we're finding, a lot of time it's hard for them to get paneled with insurance boards, right? And so that makes it difficult for the community to assess their services. But then if you want to start a private practice and make it like affordable for the community, then you suffer. So now you got to choose between a living wage and then actually servicing the community. And so DMH is great for certain things, but when we're looking at and I'm gonna give you my number, April, we could talk offline. So when we're looking at mental health equity, you're not going to really find it within that system, because that system is based on oppression, and it has not been decolonized. And so,
right, and I'm talking about those community-based organizations. I've reached out to a lot of them, and so I'm saying contracted community-based organization. We have to find a way to break down that oppression, because the children and the families are suffering.
Absolutely, absolutely. That's why databases like Clinicians of Color, Therapy for Black Girls, Latinx Therapy, they have a great base of clinicians of color with sliding scale, and who also take all kinds of insurances. And that can be a start. And so I don't know if that really answers your question, April, but that could be a start, those different databases where clinicians like myself, we would actually sign up because it's easier for people who look like us to find us.
Thank you so much for all of these golden discussions that I think we all really need to have. So from the foundations, right, to representation, all of this is such an important conversation. Thank you. We're going to move on to the next question. So what role do community partnerships play in promoting Black health equity?
We are the ground troopers. We are connected to the community. We see the people. We know where they are. We know what they need. They are safe and comfortable with us. They trust us, and they want our support. They want us to love on them because we're a part of them. And so community partnerships, working with the community working together, the organizations, nonprofit, for-profit, all of us working together, yes, we want help from organizations and governmental funding, but we got to take care of each other.
She took the words right out my mouth.
Mine too.
Right?
Right, nothing else needed.
Right there, because it is important. It's like that collaboration, because no one else is going to take care of us but us. No one else is going to look after us but us. We have to step in and ensure that we create the things that we need to be able to have the resources we need to have access to the databases, because there are a lot of people who may be on this webinar right now that are not aware of these databases. So how do we continue to educate and support and be able to put that information out there to the community so that we know that we have those resources available to us, and create our own infrastructure. Stop trying to get a seat at the table somewhere else and create our own table within our community so that we are lifting each other up, educating each other up, and bringing the health equity within our communities up.
And that you have that trust, right? That's my favorite thing about working with community organizers and community gatekeepers. The trust. So you can tell these resources, you can give all this information, but they don't know me. I'm just the person who comes in twice a week and does whatever this fancy intervention is that I thought up, right? And got money for. And so in their mind, it's kind of like, okay, she's doing this because she wants to write a paper and because she has some money. And whenever she leaves, we're just here to fend for ourselves. So I'm really big about the sustainability. And like you said, helping the community maintain and level up. And so anytime I'm able to work with a community partner, it just makes the project better. And so I appreciate you. So April, I'm giving you a hand clap on the side.
Well, I'm gonna be a Gemini. I'm a Taurus, but I'm gonna be a Gemini and say, yes, but we still got to get that money too. So all that governmental funding, all that appropriation, all those grants, all you organizations, contact me, get registered to receive that federal dollars, because those are our tax dollars and I want my reparations. So yeah.
Absolutely. And then there's also the narrative, right? Being able to speak in Ebonics. When we are communicating within our pod, we're able to speak their language. So if I'm doing a webinar, for my Beverly Hills group, I'm speaking in a different tone. But when I'm speaking with my people, I'm code shifting. And so with them having that knowing that I'm a community partner and I speak their language versus someone that comes in and does not speak their language and judges the language that they speak, it's a totally different approach, totally different understanding, and totally different appreciation from the community. And you're more likely to get a positive outcome. I mean, the County of Los Angeles just gave organizations up to $500,000 that were CBOs because they understand the importance of using those organizations to get the word out about COVID-19 and the vaccine. So, and multiple organizations, not just one, multiple organizations within the community, because they understand that we can't do the work by ourselves. We need people that individuals trust.
Thank you, everyone. We are going to move into questions from the audience, and we do have one. So again, if you have another question, please put it on the chat. So we have a question in the chat that says, how does structural racism producing inequitable access to housing, healthcare, education, employment, and healthy Black communities factor into this conversation?
That's a good one.
Right.
I don't even know where to start. I mean, that is the conversation. I mean, it's so deeply, it bleeds into all parts of this. I mean, what we're talking about, the way communities are purposely designed, right, to reduce access to quality foods. And we start talking about food deserts. There are certain communities, I don't know how many of you have actually taken note of this, right, or how openly we're having conversations about this, but there are certain communities you will go into and you will have to drive miles before you find access to food that you'd even feel comfortable eating, right? You run into a liquor store on every corner, right? And even the church on every corner. And I'll just throw that out there as fact. You'll run into a church and a liquor store, but there may be one or two grocery stores within a zip code, right? And these are communities that a lot of our people are densely populated in, right? And so if you don't have access to nutritious food to eat, right, or if you don't have access to appropriate health care within those communities, and then you got to think about the stress levels out of that alone, right? I can go on and on. I'm gonna pull out of this one because it's a really deep question, but it's so deeply wrapped around and intertwined with itself. And these are systems, and systems work within systems to support, the continuation of the system. And so we can't look at these issues one-dimensional, right? They work in tandem with each other. And so that's why, we have to have these conversations so that we can identify what the issues are. And I think as a community, band together and develop an approach on how we want to take on the resolution of those issues, right? And address these issues as a community.
I agree completely. We do have to go in and look at, well, where are the shifts? Where are the issues? Where are the areas of opportunity to move it forward? Because we have to remember, we're fighting against a system that's been around for a very long time, that's been implemented, that was designed to put us in these food deserts, in these pockets, into having access to lower education or access to food that isn't as nutritious. Because there's a big difference when you walk into a Food for Less compared to when you walk into a Gelson's or a Whole Foods. There's a huge difference from all of those things. And so we have to remember, even in our school system, the food that is being given within the school districts in certain areas, you have more fast food, more junk in certain areas. And then in other areas, you have access to more organic and healthier types foods. So it really kind of, when you think about that, and I think about when I lived in Antelope Valley, that is a food desert out. That's just a desert. That's a whole nother world out there. They don't have a Whole Foods out there. They don't have access to a lot of healthy. They mainly have food like the Food for Less and an Albertsons or a Stater Brothers, those type of things. They have a plethora of fast food places out there. They have only a couple of schools that are out there, one college that's out there, and that's a community college. And they're miles away. So they really don't have the access to health. And that's where a lot of us live. We moved out there for a better life or a better community, and yet we don't have access to a lot of the things that other communities have lived. I've been able to live. I grew up in South Central LA, and I've lived in Agoura Hills. So Agoura Hills, it was vastly different. The schools were vastly different. The community is vastly different. The access to resources for education, for health, for everything was vastly different there compared to the way that I grew up. So we have to start looking at, well, what are the things that we really need to start shifting? where are the areas of opportunity to move us into that next phase, into that evolution of being able to have access to healthier lifestyles. And there are communities that are out there that are doing amazing things, like our community gardens. I mean, how many people know about the community gardens? There's one in Watts, there's one in Willowbrook, there's one in Compton. There's so many community gardens where you can get educated on how to grow your food and healthy living. There are, there's information out there in terms of being able to look at our, like, for education and other things. So I think that it's that question is, that's a very deep question. And it's going to take more than this panel to really delve in and dissect it. But I want to say that the first thing that we have to do is start looking at how we shift it. We do need access to that funding that's out there and being able to educate those who are out there so that we know how to gain this access to those grants and access to government contracts and funding that everyone else is getting. And so then some of the other things is just us coming together in collaboration, the way that we are, and having these discussions and these panels on an ongoing basis, and being able to start early on with our children and teaching them about health, about really living holistically. And I mean that in the sense of not just holistic therapy, but holistically, meaning in your mind, your body, and your spirit. Being able to teach them from a young age, because then that trickles into the next generations and generations to come. They learn faster early on, as opposed to being more defensive when they're older, because they've already ingrained and formed an ideology around the way life is. And so those, I don't know, those are just some of the,
I can just chime in really quickly because I know you want to move on, but
yeah,
just thinking about this, and I want to go back to the question because it's really a loaded question. And it's loaded because this goes back to redlining, right? So if you think about hospitals, hospitals are our largest safety nets. That's number one. Our second largest safety nets are our schools, and then everything else falls in line. So when you think about, if you take, let's say, a certain part of Long Beach, or just Long Beach in general, how many hospitals are there in Long Beach? Where are the nicer hospitals? Who has access to the nicer physician offices, right? So you look at that. How is the health equity within our communities? How far do you have to drive from North Long Beach to get to an adequate hospital within your own city to obtain services? So then there's that. What do the schools look like in those neighborhoods, right? So all this goes back to living wages, right? Because there's redlining, there's lack of food, but you know, when grocery stores come in, they come in when they see that individuals can afford the services that they are rendering. If they see that you cannot afford, they're not going to build their business there. So therefore, we need to make sure that people have living wages. That goes back to education. Oh, are we going to dial it back to make sure that everyone is healthy within that community? You see, it's cyclical. So if we cannot get living wages to then encourage facilities to want to build within our communities, Kaiser, one of the things they do, before I go back on mute, they're starting to build community hospitals, not specifically hospitals where you can go and get emergency treatment, but healthcare centers. And within those healthcare centers, they have one in Baldwin Hills, they have one in Carson. And within those community centers, the people that work there are supposed to live within a certain mile range within that facility. What happens then? Then they live there, they eat there, they spend their money within that community. So we need to implement and get government and private agencies to want to then invest within our communities, which means we need a living wage act. That policy is what changes everything. We can get all the money in the world, but what happens is you got to get policy, and then when you get policy, guess what happens? You get money. CARES Act gave us money. The new act passed by President Biden gives you money. We need a living wage policy, so then money is rendered. Once money is rendered, we will start to see more opportunities within our communities.
Thank you so much, Alicia. And thank you all. This will conclude our panel. I think you all left us with lots to think about and very motivated to take action. So I really want to tell you all, it was my honor to be with you, all 6 of you on this panel. So thank you so very much.
Thank you.
Thank you for
Again,
having us.
Yeah.
This was
Again,
an
I just
honor.
want to express my deep gratitude for you all. You came and you did exactly what I asked you to do, and that was talk about Black health equity. It was hard for me not to jump in because, you know, that's my love and my focus, but you all have done the job and done it well. So I honor you and I thank you for your time here tonight and all of the knowledge that you left for us to just soak up and think about. One of the things that I just want to hone in on is equity. Equity being programs, education, outreach, access that meets the needs, the specialized, tailored needs of that particular population. So unless there's no tailored culturally needs to that specific population, we're not talking about equity. In addition, we need investment, continued investment, not one-stop shop investment, but continued investment into our community so that we can continue to do the work that we've been doing at this point. So I hope taking part of this panel, you see what investment in the community, what we can accomplish, in addition to what we need to move forward. So thank you very much. I want to also, if you follow our journey on Black Health Equity LB as we seek to continue to work towards building the Black Health Equity Collaborative. I also want to thank the Town Hall participants, the College of Health and Human Services. I also want to send, I don't know if she's still on, but I want to send a special thank you to my dean, Dr. Lounsbury. She has known my passion and she has really supported this work. And she has really put the action behind. She said she wanted support. This is the reason why we're able to collaborate with the City of Long Beach and the Health and Human Services. So I just want to say, you know, it's one thing to say you want to support, but the actually do it. I want to express that she's the dean that's been supporting this effort, and I thank you if you're still on the line.
Rock on, Dr. Johnson, I'm here.
Okay. Hi, Dean. But just wanted to say thank you again and give you kudos for allowing this space, and not even allowing, but supporting this space.
Well, thank you. Thank you for everybody who joined tonight and all the panelists. You are awesome. I learned a ton. My son learned a ton. So we're excited about this work. Thanks so much.
Thank you. Also, Sharon Cruz, who set this up. She's assistant to the dean. Kelsey Collins, thank you. You'll be getting communications from her. And of course, the City of Long Beach Department of Health and Human Services. So I just want to send a special thank you to all of you all and our Black Long Beach community, definitely. Just one quick announcement. I know that we are very interested in Black maternal health. There are, I want to send 2 flyers that you may be interested, that they are currently working on. So as soon as I get that, then you can see those and then we can be done. If I can find them. Learning how to work this is such a task behind the scenes. Okay. All right, I'm sending these documents. So if you're interested in supporting the work of the Black Infant Health Program, make sure to see those flyers.
Amber, I also put the next town hall meetings in the chat, so okay. I'll add them again. So encourage everyone to sign up now and register for the next town hall meetings at the end of this month and the end of May.
Yes, so April 29th is the next town hall. Yes, so again, thank you, and everyone have a good night.
Thank you. Thank you so much,
Hey.
Dr. Johnson.
Thank you. Thank you for your time.
Great job, Dr. Johnson.
Great job.
Thank you.
Thank you.
Great job, Dr. Johnson. It was a pleasure.
Thank you. Good job to you. I'm like in awe still. Yeah,
Good
thank
night.
you.
We'll talk later.
Okay, good. I hope we do.